Okay, so yes, we're going to talk about lice tonight. The head lice, ever so popular topic in school. As you can see, I'm here. My name's Adam Secory, a pediatrician at the Iowa Clinic. So this will be a discussion open. You know, if you want to stop me, go ahead, please. We'll just kind of delve into it here, and you can certainly save questions at the end or just interrupt throughout. So, all right, let's go forth. So, some of the basics here. Misconceptions with a lot of people that lice can hop or fly. They can't. They have to have contact, so crawling from one to the next. Most common head-to-head contact, especially the younger kids, mainly because of education or lack of remembering or understanding. If parents say, hey, you shouldn't share hats with Johnny, potentially transmissions there. It's just following through and executing. As is most things with kids, hygiene is huge, and that's the common reason that there's a lot. So sharing the items, like we mentioned here, is not ideal. It's discouraged, but things as such as like a headband, for instance, it's hard. It's very small. It's not apt to be the common source. Whereas a hat, stocking hat, or baseball cap, something of that nature, or even a scarf that's going to hit the lower hairline would be much more problematic. So it's more discouraged, to be honest with you. So if you can teach your kids, you know, hey, let's not share stuff so much, but kids often forget this stuff. So we do our best. Again, as I mentioned, not a true medical problem or health hazard, if you would, like an outbreak of TB of some sort. It's just more of an annoyance. Loss of sleep, secondary infections. There's itchy, scratchy. Even thinking about it makes people scratch. And so you can, certainly introduce infection by digging at your scalp. Bottom one, mentioned real quickly, there's no relationship to cleanliness or hygiene. Some people think that might be a link, but there's no such link there. You can be the cleanest of clean in your house and Corel and sanitize and Lysol, and it doesn't matter. Everyone's vulnerable here. So that's just some of your basics. Let's see here. Make sure sometimes I have some extra stuff in here that I would hate to forget about. My wife likes to add new things on here too. So she's like the expert in our house, honestly. I just talk about it at clinic and treatment. We've gone through this at our house, so she has delved into the lice treatments. So 3 stages here. We talk about the nit or the egg. These are tiny, oval shaped, like I mentioned, yellow, white. The key word there is the cemented to the hair shaft near the scalp. Usually those are the ones we focus on, not so much the ones farther out in the hair. They are tough to get out, so they literally do lay down a little chemical bond, if you will, to the hair shaft, so it doesn't comb out or pull out quickly like a dandruff. They're much harder, so we'll get to this at the end, it's more tedious to fix and to take care of at the house. Like it mentions, they're difficult to see, and it really is. If you're not getting even a little light above and looking down and really combing through, you might miss them just by looking really, really fast glance. Mentions resembling dandruff, hair product buildup, like hairsprays and whatnot, stuff I don't use, but stuff that gets there, and it can kind of mildew and cause a little gummy residue, can certainly resemble a louse. So, and it mentions, unlike dandruff, doesn't flake loose. So those take approximately, when you see them, a week or so to hatch. Okay, that'll be important in the treatment plan. The nymph, which would be the immature but hatched louse, comes out. It takes about 9 days or so. I think it indicates it on the bottom slide, to turn into the adult, which would be the one that can lay eggs and therefore perpetuate our problem. They can remain on the shaft. It will stay there even after the lice has moved on. It can sit there on the shaft, so it's an empty shelling essentially. It looks like a small adult, and then the adult about 9 days later is, we'll consider the adult at 9 days out. Can live, as I mentioned, up to a month feeding on blood from your head. So, but if they fall off, a couple days, they're done. That's their source. 6 eggs a day approximately female can lay. Okay, so, and then every egg of course can then further just balloon this problem. So if you're not on top of it and taking care of the treatment, both medicinally for some, or just, and that's usually going to be your number one treatment plan, but on top of that being very, very thorough at the house, you'll just continue to, this is a hard problem to get rid of sometimes, so. All right, over-the-counter options, we'll get down there and talk about some of those, but it mentions up there about the second treatment. There are a lot of options for treatment, a couple over-the-counters and a lot of prescription ones. And virtually every one of them, except for one, I believe, and I'm not even so sure that it has not changed its current recommendation of doing a double treatment, but all of them require treatment number 2. And that's usually on day 7 or day 9. Most of them are day 9, some are day 7, depending on what one you're prescribed. Mainly because of that last slide, as you mentioned, getting itchy. Because once you do the first treatment, then you have the 7-day period until, you know, we've going through the life cycle of the louse until you've gotten to the adult bearing, and then therefore able to again, you know, lay more eggs and kind of continue our problem. So you have to remember the life cycle. That's how we treat it. So talks about, you know, by then the visible nits would have hatched, but the louse again have to take that time to mature to the adult stage where they can again further the problem. So RID, a lot of people have heard of RID and NICS. Those are your over-the-counter ones. I don't tend to jump to the RID that much. I don't like that one mainly because the age bracket is down. You have to be at least 2. A lot of times when this hits a family, it hits everybody, you know. So then you got the younger ones even, which you can go down to 2 months of life for the permethrin or the NICS, the 1%. So it's a treatment that is on day 9, a retreatment plan. So, and that's probably the biggest thing is, and usually I tell people, just call your provider and talk to them about how to treat this, because most people, if they try to do it at home, I feel like there's always that cancer just keeps it going. But that's where we usually start, is over the counter. Mainly because it increased the potency, which there's some more slides coming forward, the side effects go up too. So if we can start with the basics and do it the right way, then we might just be able to nip it right from the start. You see you have permethrin 5%, like the last one was 1%, so you increase your potency 5 times. It's called Elamite. A little bit more effective and still not that potent, so it's not like a worry to use this stuff. It's not like a toxic thing, but it is an option that would be then discussed by provider. A lot of people like to run to that one first. They don't want to go with the 1%. They just want to get more potent right away. It's no big deal. It's not that bad. A whole bunch of other, I'm not going to go through each one of these because it's kind of boring to talk about each one, but you can see they're each a little bit different names, and some of them are lotions. And different age brackets for when you can use them, and the second treatment, like that Ulefsia there, that second one down, is day 7 for treatment. So it's just different based on, but your provider would walk you through all that. So I think we can go on to the next one here. Let's see. Okay, some more options. Basically this is for us to know, not necessarily the family to know. We would then guide you specifically based on the choice we went with. So okay, treatment considerations. So let's see, yes. So some people will do this for a month at their house without ever talking to anybody. We always encourage people calling in because of the potential incorrect use. May sound corny to say that, but it doesn't really tell you on the label how to do this when you pick up your over-the-counter stuff. So we always encourage just calling in. Scalp irritation is common. These are chemicals, so they're going on the scalp. So Benadryl is fine as a base, quick little anti-itching, or even topical hydrocortisone would be fine for the itchiness. Different instructions based on, as we talked about, based on the choice or the option we are using. One of them there, the permethrin and the NICS, talks about washing hair but no conditioner. You can deactivate your treatment plan essentially by doing that. The 10 minutes on and then rinse. Oh, it's a big deal. Those are just specific to which one you're using. So treatment failure. And this is common. This is a very common thing, just despite going through the medicines. Failing to do your second treatment. That's hugely important based on the life cycle, as we talked about. If you miss a second treatment, you're apt to have another problem. So you have to go on either day 7 or day 9 for your second treatment. Retreating too quickly. A lot of people get really antsy and they say, "Oh, it's day 3. I'm just going to do it again." And it doesn't really help because again, you're not in that time frame of a problem after your first treatment, you have to wait till at least they've gone through their life cycle to get to their point of where they're going to cause more problems. So you want to retreat on the day it's supposed to be retreated, which usually is about 9 days. Let's see, shampooing too soon after permethrin can eliminate residual effect. They actually say sometimes 1 to 2 days. So you can just kind of go without, just go all natural for a couple days, because you don't want to kill off what you've done. Okay, applying treatment to hair, it's been conditioned, we had mentioned that. That can actually do the same exact thing there. Resistance, so if you have a resistance, sometimes we just do another one. And oftentimes that would be your over-the-counter product that didn't work. Reinfestation, okay, so here's another one. You get it from somebody else that, once they outbreak, I swear everyone gets it. It spreads quickly through a classroom or a household. So you get it back after you fixed it. Of course, that's the worst. There's where your whole hygiene thing and educating your kid. Hey, again, if you don't have to put on something that's not yours, don't, type thing. So, and then improperly taking care of it at your house or personal care items. I think we have some more things about that coming up here, so we'll get back to that one. Okay, so removal. This is not absolutely. How should I say that? This is an important step to, I think, for most people to do. But if you do follow the treatment plan appropriately, it's not absolutely necessary. Now that sounds kind of weird because almost everyone does this, and I encourage people to do it. But if you're using the medicine right, you should actually go ahead and it should take care of the cycle. But with that being said, I think it's much better to go ahead and, like we had it at our house, and we literally every night at dinner, my wife would comb through as the kids ate and just tediously look close. I know, right during dinner, of all time. So I think that's important because you can just, of course, you're adding one more punch to the whole process. You're taking one step farther, which is a good step. Difficult to see, especially the long, thick hair. And the bottom one's another important one too. They tend to migrate, especially in the scalp behind ears and on the lower hairline and the neckline back here. And anything past a 1/4 of an inch, really past on the hair follicle or shaft, is not going to be that viable or worrisome. Most people try to get it out still all the way, but the ones at the tips, don't worry about. Just go in towards the scalp. That's where your problem ones are. That's where they live. They're not going to live when they're farther out. So something to kind of, when you're focusing in, because it can be really overwhelming looking at, especially the female gender in general, with the more hair. It can be really tough to get in and get everything out of there. So focus in on your spots. But again, going back to the top one, as it mentions, it's not the absolute treatment plan, but I think 99% of people say, yeah, you should try to remove them out of the hair. They tend to say, if you can't do it or miss it, if you treat it right, correctly with the right medicine, it should go away.
How do you remove it?
So yeah, I think there's some
Oh,
more.
okay.
Well, yep, no, that's a good question. So I think we're, yeah, here, let's go on to some more secondary treatment measures. Cleaning the house, the fabrics, especially things that, well, they mentioned vacuuming carpet. I mean, these things are all just sometimes a little bit over the top, but it makes people feel better. Hey, let's just clean everything we possibly can. Things that especially they're touching routinely, like the back. A lot of people forget about car seats. When they're resting their head in the back in the car. Pillows, of course, bedding, blankets, loveys, stuffed animals. All these things are good things to wash and wash again. Stuffed animals, sometimes people put them in like baggies and just put them in a room away from the kids so they can't see them for like 2 weeks. Although it shouldn't take more than 2 or 3 days to do that because they can't live much longer. But it's a good way to weed out some stuffed animals too. Kind of forget that they had them. So moving on. Freezing items, not as, I don't think is good. People mention it, but I think it's better to heat and kill things. The bagging the items we talked about. And let's see, fumigation. There are these things out there where your sprays or fogs that they sell or market over the counter, which I don't think they're necessary, and they're, this more toxic chemical that they can breathe in, so I just skip over those. Okay, and a lot of people have probably heard about the mayonnaise technique where you suffocate. No proven study has shown that works. Now, what it does do, and it does help, is it can help loosen and remove nits, because you're putting oils in the hair. Of course, you're saturating the scalp, which one takes care of the dryness and the itchiness, but two, it also makes it easier to pull them from the hair shaft. So it does help in that sense, but doesn't actually, I would never rely on that as your treatment plan, to put mayonnaise on their head and put a shower cap on and have them go to bed and say, well, that fixed it, because it didn't. So that's going to be a common mishap if people do that route. So. Okay, let's see. Avoiding head-to-head contact, we mentioned that. Sharing of personal items. Tea tree oil has been shown to have some preventative values there. I brought a little, where did that thing? Oh, here it is. This is like a little over-the-counter product called Fairy Tales. It's mentioned down there. You can make your own too here, and you can go online and actually find out how to do this. Water, essential oil, you spray it on their scalp. So I'll pass this around. You can kind of see it's detangling type.
We just bought that after the last PTO meeting when this was discussed. So do you recommend putting it on them just right before they leave the house, or when's the best time to use it?
So, I mean, there's really no right or wrong way to use it, to be honest with you. You can't overdo it, so
Okay.
you can do it
So
a
do
couple
it at
times
night
a
and
day.
then in the
We do it at nighttime at our house.
Okay.
It was nighttime.
And that'll work by the next, because I'm just worried, I want it to work while they're here, so, but you can do it both.
Right before they come to school.
Okay.
Yep.
Okay.
That's a common, right before the school in the morning, there's another, yes,
My
common use.
son loves putting it on.
Well, hey.
My daughter goes to Great Clips, and she told us to get this shampoo, which is good to use every day. So
Yep.
we've been getting that.
Same
And that's at Hy-Vee.
It's,
It comes in a green
Tea
bottle.
tree, yeah,
Tea
that's what I
tree.
use,
Oh.
every day I shampoo and condition with the tea, cause the
Yeah.
tea tree oil shampoo is very drying, so get the conditioner.
Yeah.
Okay.
And then
And-
if you have girls, have them wear their hair up, you'll never see my hair down during the day, I always have it up, just cause I'm down in their hair.
True.
They're just safe to use every day. And then,
So you put this on every day before they leave the house?
And we have been since the last PTO meeting.
I
heard about
What's that?
Somebody recommended it.
Yeah, you buy that at Target.
Yeah, Target.
Yeah.
Doesn't
Or
Hy-Vee
Amazon.
take care of it too, or, I know it's kind of a common one out
Yeah.
there now, but, okay, oh, no, these are, these
Yeah,
are my
these are-
slides, sorry, these are
Yeah.
your slides now. But in general, it's definitely I think a topic people don't maybe think a lot about until it hits their house, and what really much of a nuisance, or big a nuisance it really is, and how hard it is to fix. So getting the tedious and being tedious and thorough with your home kind of combing and looking is going to be, in my opinion, just a huge thing to do. Even though that slide kind of indicated, well, if you do it right with medicine, it doesn't matter. I think it does. So I always tell people, yeah, you're going to have to maybe spend an hour potentially for a week every night doing this. But man, it beats the whole cycle going over and over again for a month or 2 months. And I've seen people go through 6 weeks, of this, and having 3, 4, 5, 6 different medicines, even sometimes even oral, which I hate to have to run to oral medicine for this. That's really high dose potency. So typically, if you do it right, you know about it, you can knock it out in the first 10 days or so.
And your question was how to get it out, the metal comb.
Yes, back to your,
Yes.
The comb through is a great,
There's like
so,
a metal comb. And it
metal
just, like,
comb, yes, going right through and combing through, and then if you get up with a nice light, you can see it there, and you can comb it right out to the end with but it has to be pretty durable, and it can't be something flopsy or flimsy, and
Mhm.
if you try it with your finger, I mean, it's too hard. Pull out, and it's too tedious to get every strand of hair, so you want to comb through. Then you can see them gather on the comb.
What about at home sharing like brushes at home? So like the twins share brushes because I can't keep them separate because it's just not. So is that okay? Because neither one of them have lights now. So is it?
Oh, sure. So
So-
at home, if you're not, I mean, you wouldn't have to worry about that right now until you had an infestation. They could share, that's fine, but they have to, of course, if one of them picks it up, they're gonna both get it then.
Yeah.
So maybe you start, whether or not they're understanding of just doing their own, hey, you have yours and you have yours, and let's just keep it that way. You're at higher risk by sharing. But if you know there's no problems right now,
Right.
can't tell you not to either. It's just increasing the risk.
Yeah.
It'd be like sharing a drink when one has,
Yeah.
prior to a cold, well, was somebody coming down with a cold, and then now the other one's gonna get it, or is it just something we're gonna roll that dice? Obviously, when one of them has it, then we try to avoid that sharing at all costs.
So do we throw all the brushes away, or do we just keep them in a bag for 2 days?
Boil them.
Boil brushes.